Hello and welcome to my presentation. Today I'm going to be presenting on cannabis use disorder in youth and adolescents. I think this is an important topic because cannabis use has come to the forefront of our culture in recent times with decriminalization in many states and its presence on television, etc. So I think it's something that's on the top of the minds of youth as well as counselors, parents, and anybody who interacts with youth, teachers as well, counselors. So in this presentation, I'm going to be going over the diagnostic criteria for cannabis use disorder. I'm going to be going over an article by Gobi that talks about the correlation between youth use of cannabis and adult repercussions of depression, anxiety, and suicidal tendencies. I'm going to be going over some of the intervention techniques that we can use as social workers. Um, and hopefully you get a better sense of it after watching this presentation. So there's different research out there on the level of use of cannabis within the youth, but I've presented some here by SAMHSA. It does appear that use has been on the rise with legalization, although I did find a source, I didn't put it in the presentation, but there was a source that said that it had stayed stable. I do believe that's on the rise based off of this evidence. So cannabis, what is it? Marijuana, weed, pot, grass, tree, whatever you want to call it. THC is is the active chemical in marijuana that gets people high. These are the symptoms. The signs that somebody um, is using marijuana. And so these are some of the different forms of weed. We shouldn't be scared of them. We should just understand them. What does it look like in our youth? What does it look like when they're using? It might change. It used to just be joints. Now it could be vapes. Now it could be creams, candies, right? So there's different forms that we should understand. This is from a SAMHSA guide about youth marijuana use. It's a very useful source on this. Cannabis related disorders. What are the criteria? They have to have one of these 11. And I'm sorry, two of these 11 in order to be diagnosed. And so I think it's pretty easy to meet at least two of these criteria, but it's important for us to realize that there's different severities. So if it's 6 or more, you're probably noticing it. They have weed on them all the time. They smell like it. Their eyes are red. They're using eye drops. This one, it might be less severe, but still something that should be addressed, right? So you can tell based on these symptoms if somebody's intoxicated, right? Dry mouth, using eye drops, spraying perfume, recent use of cannabis. They have it on them, right? So I thought it was important to include Erickson's stages, stage 5 as well, because this is a time when a lot of youth start using drugs and alcohol. They're trying to find their identity, they're trying to find their sense of self, and so they might resort to using substances, including marijuana, right? They're confused. They might try it once and realize, no, this is not part of me. This is not my identity. Or they might depend on it as part of their identity, right? So this really fits in with this topic. So adolescence, right? This is where it can develop and be a problem. Facts about marijuana use disorder in youth. Basically, this is saying that the younger that you start, the more negative effects it might have in the future. And so it's good to encourage youth to avoid using marijuana, especially under 15, under 14, right? So these are some of the effects that it can have on there's learning issues, memory issues, cognitive processing. All of these um, important aspects of youth development can be affected by short or long-term marijuana use. So I think we really need to understand that. Studies show impairment, but they also show that it can be repaired with abstinence. And so it's good to know that there is a solution to it, right? Um, there is a strong correlation with psychotic disorders and marijuana use, but our authors that we'll analyze afterwards, they they wanted to link depression, mostly depression, suicidality, anxiety to cannabis use, not just psychotic disorders. So we're going to get into the article now. So these authors analyzed 11 different articles, and they wanted to ask the question, is adolescent cannabis use associated with risk of depression, anxiety, and suicidality? And their answer was yes. And so they analyzed 11 different articles from a macro level. And so they took these articles that looked over time. They followed individuals who had used marijuana as youth under 18, and then they tracked them up until 34, or they analyzed them afterwards when they were young adults between 18 and 34. So it was interesting because they found a correlation for all of these different issues, diagnoses with cannabis use in youth. And so these are the rates, right? 1.44, 1.5 for depression, compared to somebody who didn't use it at all as a youth. Anxiety, right? And then the worst one is suicide, right? In Australia, they're saying it's 6.83 um, times more than a non-user, a non-youth user, right? And so these are the results. I will let you go over this later. It is a little complex, but they analyzed 3,142 articles, um, and broke it down, to get these results. So their conclusions were that although individual risk level remains moderate to low, this study should be used in the future, and it does show a correlation between depression, suicidality, and cannabis use in youth. And so counseling, what can we do about it, right? As social workers, we have to see what their environment is like at home. We have to see what their culture dictates. We have to see what other co-occurring mental health or other disorders they have, right? We can't just look at it inside of a vacuum. So I'll go over the protective and risk factors. This was great. It came from SAMHSA as well. So, right, if the individual is um, has self-efficacy, if they are motivated for college, if they are into sports, they have all these characteristics that'll help them, and they might not be as susceptible to the addiction as opposed to all of these other problems, right? In their family, are their parents using? Are their parents, have low education and haven't been able to teach them about substance abuse issues, right? Those could be risk factors. On the other side, these are protective factors that are really going to help the child. And then again, in school, if it's a child who's in a low socioeconomic neighborhood where the school is not funded well, they might not have good policies. They might not have enough staff to monitor the children. This could be a problem. Whereas a child who lives in a wealthy area with high property taxes might just have all of these protective factors. So this is all really important to understand also. Counseling techniques. These are some different assessments. Craft, ASAM. This provides. This helps us understand the level of care that they need, right? Ask questions, ask good questions. And then these are some of the different treatment options. Outpatient, which is sort of the lowest level, and then the highest level would be inpatient. And so inpatient is going to include group therapy, possibly 12-step, individual therapy as well, academic support. And then the other ones are more step downs, intensive outpatient, partial hospitalization. It's all up to the social worker and family to understand the addiction and address it with one of these, the most appropriate options, right? So I took this out of the book. It was very helpful. And in conclusion, we really have to realize that cannabis is a drug. It is important for us to understand and talk about. We have to be open about it in order to address the problem. And I hope that you took something out of this presentation. Thank you.